A new study paints a grim picture of what foreign aid cuts could do to HIV prevention efforts around the world. The research published in the Lancet HIV journal estimates reduced aid could cause up to 10 million new infections and almost 3 million HIV-related deaths between 2025 and 2030, which is really stunning. Let's bring in Dr. Céline Gounder now to break down this study for us. She's a CBS News medical contributor and the editor-at-large for public health at KFF Health News. Dr. Gounder, what do you make of these numbers? They seem quite alarming to me.
These numbers are staggering, Errol, and we still don't know exactly how badly U.S. foreign aid for HIV programs and other global health programs is going to be hit. We've seen that the USAID, United States Agency for International Development, has been gutted. But we haven't yet seen the degree to which CDC funding for PEPFAR, the President's Emergency Program for AIDS Relief, we haven't seen yet how much those cuts will be on the CDC side. So this has been a collaboration between USAID and the CDC since it was started in 2003 under President George W. Bush.
And earlier this week, you were helping us understand the impact of some of these cuts here in the U.S. This study examines how it will hit 26 countries that rely on this aid. Help us understand the dynamic in those nations and why they need this assistance.
Well, many of these countries rely heavily on the United States. Some of them, between 50 and 70% of their budgets for HIV diagnosis, treatment, and prevention is coming from the United States. The U.S. is by far the biggest donor in this space. About 70% of funding for these kinds of programs worldwide are coming from the United States. So there's not really any other country that can easily step in. And big picture, this is sort of like telling a surgeon in the middle of surgery to walk away. It's just not that easy to jump in and take over.
And before we let you go, Doctor, the Department of Health and Human Services announced that it is cutting 10,000 jobs. That announcement coming just yesterday. What impact is that move likely to have?
Well, it's going to have wide ramifications. HHS includes numerous agencies. Two of the hardest hit we know will be the FDA, Food and Drug Administration. So as the name says, they regulate our food in certain respects and also vet and approve medications, vaccines, medical devices. We can certainly expect that there will be impacts on that front. The CDC we also know is being very hard hit. And that will impact our ability to address global health as well as domestic public health issues here in the United States.
All right, Dr. Gounder, a sobering update there. We appreciate you joining us. Thank you.